Banner Children's, we've got pediatric care covered for Arizona families.
And I try to focus on her so I can describe her charge syndrome to you, but charge syndrome is a wide variety of things. Is that you form from the back to the front in like a circular motion, and she never closed all the way on the inside. We really try to stick with Cardin's because it's the people, the knowledge, the doctors, the nurses. They all just are amazing. They work together to save her life. I mean, she wouldn't be here if it wasn't for them.
Some of the complicated patients that we take care of have multi-system involvement, sometimes neurological involvement in the lungs, the airway, the GI tract, and even other organ systems are affected. So we have multiple specialists in a vast array of different specialties to manage our children with complicated medical issues.
She has been through so much, especially the first 3 or 4 months of her life. You feel overwhelmed in paperwork, you feel overwhelmed with bills, you feel overwhelmed with trying to, how do you go home with you came to the hospital with a child that had no machines and you're leaving with 6 machines. You know, you have to have that whole realm of everyone that's going to get together and help you learn how to manage your new life.
Hello,
what good care you take of her.
Hello.
And she loves you.
For the patient's benefit, having the comprehensive care or with the multiple specialties, we can provide the care that the patient needs instantaneously. We can get hold of each other, we can compare notes, we can look at the studies and make decisions much faster and prevent the delay of proper care.
Feeding is still, we're struggling with the feeding. She's not getting the nutrients that that they want her to be getting.
Hello.
She just doesn't tolerate the upped calories or anything. Yesterday, her swallow study, she didn't pass it, unfortunately. You know, they all are really good about calling each other. We'll be at appointments sometimes, and the doctor's texting about her, asking how she's doing, or the other doctor just called and said, oh, you know, check on this.
Just pick up the phone and say, talk with one of my neurosurgery friends or one of my ENT or surgery friends. They'll get on the phone with me quickly and we could solve a problem right away rather than have it linger and then have more problems down the road.
Hi.
But she's pretty interactive. She's really on target. The key in her care is the anticipation of potential problems.
And that's the main thing, is when you have a doctor that's saying, this is what we need to do, this is where we need to go, this is how we're going to do it, and they get us to who we need to go to, it's amazing. I have full trust in all of these doctors. I mean, full trust. And that's my baby. It's my life. You know, for me to say that, it takes a lot to earn my trust. A lot.